Taliglucerase Alfa Solution, Reconstituted, Recon Soln, is a medication used to treat a rare genetic condition called Gaucher disease. This medication works by replacing a natural enzyme called glucocerebrosidase that is missing in people with Gaucher disease. It helps improve blood, bone, liver, and spleen problems caused by Gaucher disease. It is important to note that taliglucerase does not correct the genetic problem, and treatment must be continued for life. The daily dosage of Taliglucerase Alfa Solution, Reconstituted, Recon Soln, will be determined by your doctor based on your individual needs and medical condition. It is important to take this medication exactly as prescribed by your doctor. The best time to take this medication should be discussed with your healthcare provider. When using Taliglucerase Alfa Solution, Reconstituted, Recon Soln, your doctor will administer the medication slowly into a vein over 1 to 2 hours, typically every 2 weeks, based on your weight, medical condition, and response to treatment. If you are using this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional. When mixing the solution, do not shake it and visually check for particles or discoloration before use. Discard any unused prepared medication and learn how to store and discard medical supplies safely. While receiving the medication, you may experience side effects such as headache, chest pain, nausea/vomiting, dizziness, increased blood pressure, weakness/tiredness, back/joint pain, flushing, and coughing. If this happens, your doctor may temporarily stop or slow down the medication infusion and may prescribe other medications to treat your reaction. It's important to inform your doctor if your condition lasts or gets worse. Blood, liver, and spleen problems usually improve in the first year of treatment, while it may take 2 to 3 years of treatment to see the full benefit to your bones. As with any medication, Taliglucerase Alfa Solution, Reconstituted, Recon Soln, may cause some side effects. These can include redness, pain, itching, or swelling at the injection site, as well as runny nose, sore throat, or flu-like symptoms such as fever, chills, muscle aches, and tiredness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of potential side effects. Fortunately, many people using this medication do not experience any serious side effects. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist for further guidance. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting taliglucerase, make sure to inform your doctor or pharmacist if you have any allergies to this medication or any similar medications. Also, let your healthcare provider know about your medical history before using this medication. If you are pregnant, use this medication only if it is absolutely necessary and talk to your doctor about the risks and benefits. It is not known whether this medication passes into breast milk, so consult your doctor before breastfeeding. Before undergoing any surgical procedures, inform your doctor or dentist about all the medications you are currently using. When taking Taliglucerase Alfa Solution, it is important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. This includes both prescription and non-prescription drugs, as well as herbal products. It is recommended to keep a list of all the products you use and share it with your doctor and pharmacist. It is crucial to follow your doctor's guidance and not make any changes to your medication dosage without their approval. If you suspect an overdose and notice severe symptoms like loss of consciousness or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to note that you should not share this medication with others. Your doctor may also want to conduct lab and medical tests, such as IgG antibodies, while you are using Taliglucerase Alfa Solution, Reconstituted. It's important to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Taliglucerase Alfa Solution, Reconstituted, Recon Soln, at the scheduled time. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to create a new dosing schedule. It's important not to take a double dose to make up for the missed one. When you have the unmixed vial of Taliglucerase Alfa Solution, Reconstituted, make sure to store it in the refrigerator, away from light. It's important not to freeze it. Once you've mixed it, be sure to follow the product instructions for storage and ask your pharmacist for any details you're unsure about. If you have any leftover solution, make sure to discard it properly and keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard it when it's expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.